Our NHS is in crisis. So whose fault is it and how did we get here?
Waiting times across Scottish A&E departments have matched their worst level on record.
The Scottish Ambulance Service is now operating at their highest state of emergency.
Some patients have been waiting in the department for over 12 hours.
The running of Scotland's NHS is the sole responsibility of the Scottish Government.
Management of the NHS is our responsibility, nobody else's.
That means the SNP government sets its budget, decides its priorities, and they're responsible for its outcome.
It's on their watch that we have seen people waiting 19 hours for an ambulance.
People waiting on a trolley in A&E for as much as 17 hours.
And tragically, people dying due to short staffing.
Long shifts and staff shortages are taking their toll.
This is a problem that's been 15 years in the making.
In August 2021, the SNP published their NHS Recovery and Catch-up Plan. It was their answer to the difficulties facing health services after the pandemic put hospitals, staff and patients under considerable pressure.
But things have only got worse since then. When the SNP published their plan, 1,463 people waited more than 12 hours in A&E that month. In September 2022, after more than a year of the so-called recovery, that figure has soared to 5,296. That's 3.5 times the number of people. Their plan has failed.
Instead of taking responsibility for week after week, month after month of the worst performances on record, the SNP are always looking for ways to spin the figures.
Your government has already cast doubt on this data.
Or placed the blame elsewhere.
Of the pressures on our National Health Service, of course there has been a global pandemic.
What's not helping is the folly of Brexit.
There's no doubt that these things have exacerbated the problem.
But they didn't create the problem.
Long before COVID, Scotland had growing waiting lists.
When the SNP came to power in 2007, 260,000 Scots were on an NHS waiting list. In 2019, before COVID hit, that figure had risen to 420,000. When Nicola Sturgeon became First Minister, 21 people had waited over a year for inpatient treatment, instead of the legal 12 weeks. But by the end of 2019, this had already soared to 1,290. That's 60 times higher on Nicola Sturgeon's watch before the pandemic. Cancer waiting times have hit their worst level on record, and the SNP haven't met their 62-day cancer treatment standard even once since 2012.
And if they aren't blaming the pandemic, it's the fault of Brexit, especially for the problems we are seeing in the NHS workforce.
The biggest barriers to getting people into the social care workforce is Brexit. Recruitment within these professions is challenging, nationally and globally, made more challenging by Brexit.
Now, of course, that has caused a problem, but is not all of the story.
Even before the pandemic and Brexit, we had record high levels of vacancies in our National Health Service.
At the present time, 1 in 9 nurses are leaving their jobs. For the first time in its history, the Royal College of Nursing in Scotland have voted for strike action.
RCN will announce its strike dates.
Not just over pay, but also because they've been underpaid and undervalued for years. That's before the pandemic and before Brexit. This workforce crisis has been growing for years. So why have nurses been under so much pressure? Back when Nicola Sturgeon was Health Secretary,
Politicians should always start with an apology.
she slashed student nursing and midwifery places by more than 1/5. That's cutting 2,000 nursing jobs. She was warned about the consequences, but at the time, she described this as a sensible way forward.
The SNP also blamed Brexit for soaring rates of delayed discharge. Delayed discharge is when someone is deemed fit to go home but is stuck in hospital because they can't get a care package. And it costs the NHS millions of pounds every year. So many people are stuck in hospital that it's the equivalent of every single bed, every single day for a year and more of the Queen Elizabeth University Hospital. That's the equivalent of the delayed discharge across our country.
The truth is that as far back as 2015, delayed discharge was already costing Scotland's NHS £132 million a year. The SNP promised to end the practice, but have failed to do so. Another broken promise. This is the result of the SNP's mismanagement of social care and compounds the problems created by their cuts to the number of hospital beds.
Now 1 in 7 Scots are on an NHS waiting list. That's almost 750,000 people waiting for a diagnosis, waiting for treatment.
Staff are being let down and asked to do the impossible.
Patients are being let down and being asked to accept the unacceptable.
We can't go on like this. We need a government that cares about our NHS, that listens to staff and patients and puts them at the heart of everything we do.
It's time for change.